Hi everyone, welcome to the class on the hypolipidemic agents. So under hypolipidemic agents, PCSK9 inhibitors are the newer inclusions. So let's understand this. So the PCSK9 stands for, it is a proprotein convertase subtilisin casein type 9. Basically, these drugs will going to inhibit the activity of PCSK9. So we have monoclonal antibody against PCSK. So we have evolocumab, we have alirocumab, and we also have inclisiran, which is the drug which inhibits the PCSK9 formation itself. So these are the three drugs which you need to remember. So next, move on to the actions. So basically they are the monoclonal antibody which reduces the serum LDL cholesterol. How it acts? The PCSK9 inhibitors or the monoclonal antibody which are against the PCSK will bind selectively to this PCSK9. Thereby it prevents the circulating or prevents the activity of PCSK9 from binding to the low density lipoprotein receptors which are present on the liver cells. So these drugs will going to bind to PCSK9 and prevents the PCSK9 from binding to the low density lipoprotein receptors. So thereby they prevents the PCSK9 mediated LDL receptor degradation or breakdown of the LDL receptors will be prevented. So what happens when you preserve the LDL receptors which are present on the surface of the liver? You're going to increase the levels of receptors which can reduce the serum LDL cholesterol. How? Once you increase the LDL LDL receptors on the surface of the liver, it will going to increase the uptake of the LDL cholesterol in the serum to the liver. And also it upregulates the LDL receptors once you inhibit the PCSK9 activity. Thereby, ultimate goal is these inhibitors will going to increase the clearance of LDL cholesterol from plasma into the liver cells. So basically these drugs are given through subcutaneous every 2 to 4 hours. And please remember, alirocumab is given subcutaneously every 2 weeks. So it is a long acting drugs. And where they can be used? They can be used in primary hypercholesterolemia and as well as in case of mixed dyslipidemia as an adjuvant to diet. So diet has to be controlled. Along with that, you need to use these drugs in case of hypercholesterolemia. So the specific side effect associated with this PCSK9 inhibitor is the nasopharyngitis and the influenza-like symptoms. So this was all about the newer group of hypolipidemic agents. Thank you.